Good morning, everyone. Thank you for attending our session. I'm Cameron Stewart, and I'm joined by Jack and Thilaksan, who have just been introduced. We're from the Population Health Analysis team at the Department of Health and Social Care, and we are here to share our new Python package, PH Stats Methods, or to give it its full name, Public Health Statistical Methods. Now, it's fairly self-explanatory what this package, the scope of this package is. It contains a number of methods and functions useful for statistics relating to public health. So we'll have a quick run through of the agenda for the session. We'll introduce the package, give an overview of what it can do and why we built it. We'll give a quick demonstration of some of the functions to give you a further scope of what it can do. We'll discuss some plans for future development, and of course we'll have the Q&A session at the end. So, why did we build this package? The obvious reason is for the output. It's to help produce official statistics and to streamline large calculations relating to public health. But we also wanted to implement firm testing and exception handling to be confident in the results that our user can reach using the package. We wanted it to be as user-friendly as possible, and we wanted to allow the user the chance to choose either the R or the Python version of the package. This is very much a spiritual successor of a package our team has released in R previously, PHE indicator methods, which is still widely used in the production of our statistics today. So here are the principal functions within the package. We have DSR, IS rate, IS ratio, a number of funnels functions, proportion, quantiles, rate, and mean. Now, the more eagle-eyed amongst you might have spotted that some of these functions are relatively straightforward to perform yourselves, and you would be correct. But the true value of the package is in the back end, where we have a number of validation and testing functions to ensure that you reach an accurate result. And also we have confidence intervals built in where appropriate as well. But to actually see them how this works, it's probably best to see them in action, so I'll pass over to Jack to take you through our first function.
Thank you, Cameron. Firstly, I'd like to talk about the doc strings of the package. Obviously, this is a new package, so you wouldn't have used any of the functions. You may have used the PHE indicator methods package, but this does have some slight differences where we've tried to improve the naming of some of the variables. So all the functions do have doc strings, which basically give a brief overview of the function, the variables used, and the results you can expect. It will allow you to kind of see how the variables need to be inputted, so whether it's an integer, a string character, and it will also give you an example of how the function can be used with some like dummy data that we've created ourselves. So I'm going to show the pH proportion function. I will warn you, it's very in your face. We didn't know how big the room was going to be, so we put the function kind of full screen. So that's just a heads up. Yeah, so this is the pH proportion function that I personally wrote for the package. It's not really, I guess, useful for the user to see because you wouldn't have to use really any of this. You'd write a simple one line of code to use the function, but we thought it'd be nice to show some of the back-end work and the work that we've actually done ourselves that's gone into the package. So I'm going to walk through a quick demonstration of it, though. It is just screenshots. It's just easier to talk through it. So this, as you can see, it says at the top, pip install pH stats methods. That's how you would install the package. Very simple. There is also, it can be installed on GitHub as well if that's easier for you. We do then import the package, and we have our dummy data in the middle under df. You can see this is the data that is used in the doc strings. We've just pulled it straight out of the example. And the bottom line of code is all you would have to run the proportion function. The numerator and denominator columns can be substituted for whatever your columns are named. They don't have to be named that. If it's, for example, count or population, those can go in. This is the output that you would get for your proportion function. It's returned as a data frame. The majority of the functions are created to be used on data frames. So the outputs are all data frames. You can see it does give you your confidence intervals and your values. You can change the confidence intervals, and also a lot of the functions allow you to group by different columns if you want other columns involved, or if you want to group by certain things like, for example, gender or ethnicity or areas. And I think the next one is IS rate, and I'm going to pass on to Thilaksan to show you about that.
I'm going to be talking about the IS rate function. Here we have the same bit of code that Jack described. The IS rate is a crucial tool for analysts in public health because it allows us to compare the observed number of events in a study population to what we'd expect based on a standard population. The comparison helps us identify significant deviations and patterns in data, facilitating better decision-making, public health policy and interventions. I'm going to show you the input. Here we can see the input parameters for the IS rate function. Users need to provide the observed events and the expected events. Additionally, demographic breakdowns that influence the standardization process can be specified. The flexibility ensures that the function can be tailored to various datasets, maintaining the accuracy of the statistical analysis. Here we have the output. The IS rate function is displayed. The output includes standardized rate, confidence intervals, and other relevant statistical measures. The clear and comprehensive output helps users quickly interpret the results and draw meaningful conclusions. By automating these calculations, the PH-Stats method package significantly reduces time and effort needed for complex statistical analysis, allowing public health professionals to focus more on application and less on computation. I'm going to hand back to Cameron.
So the package will have ongoing support moving forward, so if any users of the package have any issues, they can log it at the GitHub that's linked there, and we'll be able to resolve it as soon as we can. We also have some future development in mind in the future, particularly the life expectancy and SII methods have been identified as our most short-term goals. And as Jack briefly touched on, you can download it either directly from the GitHub, and the package is available on PyPy, so it can just be downloaded directly via the console. And once you have it there, you can just import it using the standard method and call help on either the package itself directly or on an individual function if you want access to those doc strings, examples, and information about the parameters. And that's the end of our presentation, so if there's any questions.
Just to remind everybody, we have Slido that's open on 3716942, and you can uptick questions that you like, but there is one here that I will ask. What makes this specifically good for health statistics rather than another more standard Python package?
So I don't know if you've spotted on previous slides, maybe just rewind. We have methodology in there for confidence intervals that are directly recognized to go with each method. So for example, I think this is ISR, so Bayer's as well. It's apologies. This is having it all in a one-stop shop to be able to produce these statistics is, I think, fantastically convenient right across the board. And it does have these commonly used confidence intervals and functions within it.
I'd like to ask a question and add to that as well, because it's from public health. So I've used the other package that you used in R. So I feel like I can go to that and give some surety that it came from public health. But just on that, you'll be developing this package in Python. Do you know if the R package would also receive the same developments to keep in line?
Currently, we don't actually know that, but we can easily get in contact with the people that have created the package, and we can see if those updates would be made available to R if people would like that.
That's wonderful. Thank you very much. Can you summarize advantages of Python over R? That's a great question. That gets the room going.
To be honest, when it comes to the package, there's not necessarily any advantages to using the Python package instead of the R package. It's more just a case of giving people access to use both, depending on what your department uses. Our department typically uses more R, so this is maybe something that we wouldn't use personally as much, but we know that other departments might be more Python heavy and it would be more useful for them.
lovely answer, and certainly one I would definitely agree with, and get my words mixed up. Thank you so much, everybody. I'll just, round of applause again, please. Thank you.